Hello everyone, my name is Diane Sanborn. I've been a nurse for over 40 years. As we battle the COVID-19 coronavirus, I hope to share some of my experience and knowledge about infection prevention and control, as informed by public health officials in Toronto, Ontario, and Canada. With no immunity or vaccine, the virus is spreading rapidly throughout the world. Current estimates indicate 20% of infected persons will need hospitalization, and 1% of them may die. Most at risk are the elderly and those with immune-suppressed conditions and/or chronic illnesses. To combat this disease, it is vitally important for people to understand how the disease is transmitted and what actions we must take to mitigate the spread. All coronaviruses, including the common cold and flu, are transmitted between humans via droplets from sneezes, coughs, or direct contact with handshakes. An infected person who neglects to use cough and sneeze etiquette will carry that viral load on their hands for 10 to 15 minutes. Clothing can hold the viral load for hours, and it can remain on hard surfaces including doorknobs, railings, table surfaces, computer keyboards, phones, and elevator buttons for up to 9 days. A healthy person can pick up the virus on their hands, touch their own face, which humans do about 90+ times a day, and the virus will enter the body through their nose, mouth, or eyes. Hand hygiene is the most important component in the battle against COVID-19. Wash your hands frequently for 20 seconds with warm water and soap, including fingertips, palm, thumb, and wrist. Hand sanitizer is a good second option. Avoid contact with public surfaces like railings or handholds. Use paper towels to turn on and off taps and open doors in public restrooms. Wash your hands immediately upon arrival at your destination and sanitize surfaces in your workspace. Social distancing is the separation of people in public spaces to prevent transmission. Avoid crowds and strive for a 2-meter distance between you and other people. Clothing can hold a viral load, so if you've been among other people in a crowded space, you may want to remove and launder the clothes you've been wearing when you get home. Personal protection equipment, or PPEs, is used by healthcare workers and support staff, such as social workers, when attending to a client in quarantine who may have an infectious disease. It's important to don and doff your PPE in the right order. First, perform hand hygiene. Second, put on the gown, ties in the back. Third, put on the mask. Fourth, put on the goggles. Last, put on the gloves. When you are finished with the visit, make sure there's a receptacle to dispose of your PPE, and then remove the gloves, Remove the gown and roll it up inside out. Perform hand hygiene. Remove the goggles. Remove the mask and perform hand hygiene one last time. With COVID-19 testing centers opening up across the Ontario province, we will soon have a more accurate understanding of where infection outbreaks exist, who needs quarantine, and who needs hospitalization. But it is up to each individual to take actions now to protect yourself and those around you. Stay informed, be proactive with the measures I've described, and advise your clients to do the same. Here are some relevant contact numbers and links to public health sites. I've sent these to your managers and supervisors in RCC unit. Thank you. Thank you so much for all you do in service to our WoodGreen clients.